Happy morning, everyone. Welcome to Metier YouTube channel. I hope you are all fine and preparing well for your exams. We'll start today's 5 important MCQ for the exam of JIPMER and AIIMS. Before that, we'll start with a small quote. Don't stop until you are proud. Whenever you're starting something, that end up should give your accomplishment that you are proud enough. So that's something you have completed, something you have done and good for yourself. Okay, that thinking should be there. Okay, yes, we'll start today's session. First question: which of the following refers a patient who enters a hospital with a known infection? So options are nosocomial infection, heterogenic infection, community acquired infection, idiopathic infection. It's look like a simple question, but you have to carefully read the question. The question given the patient who enters a hospital with the known infection. Okay. After entering the hospital, it will be option A. After entering the hospital, after admission of the after admission, the patient gets the infection. That comes under nosocomial infection. Before entering the hospital itself, the patient is having the infection means that is called a community acquired infection. Clear? The term used to describe the infection that is acquired outside the hospital. Example like a home, in community, in particular area. Okay, they come with the signs and symptoms of infection. That is called a community acquired infection. What is option B? Heterogenic. Because of some procedure. After admission, some procedure will lead to the heterogenic infections. Clear? Idiopathic infection means unknown cause. We need to rule out the exact cause for the infection. That is called the idiopathic infection. So the question is asking the patient entering the hospital with the known infection is, it is community acquired infection. Yes. Next question. Which of the following are the corresponds to of the chain of infections? Okay. Components of the infections. Options they are given: mode of transmission, host, infectious agent, portal of entry, portal of exit. And portal of entry, infectious agent, host, reservoir, portal of exit, mode of transmission. Option C, host, infectious agent, reservoir, portal of exit. Option D, portal of exit, host, infectious agent, reservoir. So what they're asking, the chain of infections. I hope you know the chain of infection, how the pathogens are entering in our body and how it's getting multiplication, then how it's getting out of the body, how it's transmitting. So that is called a chain of infection. So the correct answer is option B, portal of entry first, then portal of entry of the infectious agent that goes to the host. That in host it will get multiplied, that is called reservoir. From the reservoir, from the patient, it will get out, that is portal of exit. Because of some mode of transmission, it will transmit to the other person. So you can relate like this. So this chain of infection, you can see it here. We have to start from here, portal of entry. Okay, it will go to the host, or because of infectious agent. You can interchange this two. This infectious agent and a susceptible host, we can interchange in both the way. First is portal of entry, the organism entering into the particular person. So that is why we given host. Next is infectious agent, particular microorganism is called a infectious agent. What is reservoir of that infectious agent in a particular person? It will get multiplied. That is called a reservoir. Next is portal of exit. After multiplication, in some way it will get out through the wound, through the nasal secretions. Okay, so that is called, or through blood. Okay, that is called the portal of exit. After exit, it need a mode of transmission, direct contact, airborne infection. That is comes under mode of transmission. Through this mode of transmission, it will spread to the another person. This is a chain of infections. You know, you should know when. What is the first point? That is portal of entry, and finally is mode of transmission. This is the pathway. So don't forget the order. These two you can interchange. Susceptible host and infectious agent, you can interchange it. Next question. Which of the following immunity develops in response to an infection? This I think already we have seen the immunity. Same one more time we are discussing it. After following an infection, options are given: innate immunity, natural active immunity, artificial active immunity, and passive immunity. So the answer is natural active immunity. After getting in a particular infection, our body will develop an immunity for a longer period of time. Okay, that is natural active immunity. What is innate immunity? Option A. Innate immunity, nothing but after the birth itself. Okay, after the birth itself, our body's first defense mechanism is called innate immunity, like skin, mucous membrane, that and all comes under innate immunity. By birth itself, we will have no skin, mucous membrane, that and all our first defense mechanism. What is artificial active immunity? After giving a immunization, that is called artificial active immunity. Option D is passive immunity they are given. Passive immunity we have natural and artificial. I'll show the picture so that will be easy for you to understand. You can see it here. Immunity is divided into two types: adaptive immunity and innate immunity. Innate by birth itself. Adapting throughout our lifespan, we will earn it. Okay. So further divided into two types: natural and artificial. Natural passive means maternal. Passive means maternal, from mother to the fetus. Immunoglobulins, that is antibodies transferring. No, that is called natural passive. Okay. Natural active, that is what the question is asking. Natural active means after a particular infection, our body will get developed immunity. That is natural active immunity. Right? Example, chicken pox, that and all. Next is artificial, passive and active. Passive means artificially we are giving immunoglobulins, antibody, M and all. That is called the artificial passive. Artificial active means immunization. After giving a vaccination, our body will get a immunity. So these are the types of immunity. The question is asking about after getting an infection. So the answer is natural active immunity. Clear? I hope you understood. Next question. Gram positive and gram negative bacteria are what? The question is asking what is gram positive and gram negative. The options are asking, they're given: study of bacteria. It is denotes the color of the bacteria when the special stains are used. Option C, the scientific study of the microorganism. Option D, multicellular animal forms, for example, roundworm, tapeworm. So what are they? What are the gram positive and gram negative? The answer is it denotes the color of the bacteria. In our in microbiology, we have learned gram positive and gram negative bacteria. So how they're classified as a gram positive and gram negative? Gram positive, nothing but when you use a special stain, it will observe the stain and it will be what in color? That is purple in color. So whenever you do the staining, if the microorganism produces a purple in color, that is gram positive, PP, positive purple. You can remember like this. Then gram negative means either it will be in a pink color or in the red color. Okay, so it denotes the color of the bacteria when the special stains are used to detect the particular organism. Got it? Clear. Yes. Next question. Protozoa is an. What is protozoa? The question is asking what is protozoa. Option A, worms. It is a one-celled animal. It is a viruses, or it is the smallest of all the microorganism. What it is? Protozoan is an one-celled animal. Okay, because protozoa are single-celled organism that belongs to the kingdom of Protista. Okay, so that is why it is called a one-celled animal, because they are having the eukaryotic cell like of us. Okay, protozoans are having the eukaryotic organisms like animal, plants. Okay, so that is why it is called a one-celled animals. What are the examples of protozoa? Like paramecia, flagellates, amoebias, that and all comes under protozoa. Clear? Yes. I hope so. Today's class was helpful. Prepare well for your exams. We'll meet in the next class. Thank you so much.